Hey, Tony, good morning. And we are learning more about this every single day. In fact, a new study released by the CDC examines exactly how COVID can be linked to an increased risk of blood clots, especially in stroke patients. Now, I spoke with the cardiologist right here at Kaiser Permanente about what he sees firsthand and the steps that we can all take to prioritize our heart health. From COVID long hauler to the inflammation of the heart muscle, these are just a few of the symptoms shared by those who previously tested positive for COVID-19.
There are a few conditions that are directly related to a COVID infection. Long COVID is sort of your body's cardiovascular system responding in a funny way to a COVID infection.
It's a response that experts say can last for 6 to 12 months. But what about after that? I spoke with Dr. Amaya Kulkarni about the long-term ramifications of COVID-19. It's a question the American Heart Association hopes to answer with a new $10 million research initiative examining COVID's impact on the cardiovascular system.
On average, patients' blood pressure in the United States has gone up versus 2 years ago, and disproportionately it's affecting women.
Experts say there's a number of reasons they're seeing this.
We are attending to so many more things at once than we ever were. The stress levels are higher than they've ever been. Most of us are less active than we were.
And Dr. Amaya Kulkarni says it's a trend he not only sees in the hospital, but in his own home.
My personal theory, having watched my wife manage the pandemic, working as a mom and the wife of a cardiologist, her stress levels are about as high as I've ever seen them.
Yeah, I think we all are feeling that now, especially this month in honor of American Heart Health Month. The American Heart Association wants to remind you of a few simple steps that we should all be taking, and that includes monitoring your stress levels, taking care of what you eat and how much you are exercising. And the key takeaway here, Annie, they say it's a good idea to try to get back to the habits that we were in before the pandemic began.